of the questions. So let's start with the question number 1 of part 3 of General Pharmacology series. So question is, which of the following drugs is a potent inducer of CYP3A4? Options are, first option is ketoconazole, second option is rifampicin, third option is erythromycin, and fourth option is cimetidine. So the correct option is option B, rifampicin. So option B is the correct option, rifampicin. Question number 2. A patient taking warfarin develops excessive bleeding after starting which drug, most likely due to enzyme inhibition? Options are phenytoin, option B rifampicin, option C fluconazole, option D carbamazepine. So the correct option is option C fluconazole. Option C is the correct option, fluconazole. Let's move to the question number 3. Question number 3 is, which receptor is directly linked to activation of adenyl cyclase through GS protein? Options are alpha 1 receptor, option B beta 1 receptor, option C M2 receptor, option D D2 receptor. So the correct option is option B beta 1 receptor. Option B is the correct option. Question number 4. Acetylation is seen in all except. Options are INH, option B phenytoin, option C hydralazine, option D procanamide. So the correct answer is option B phenytoin. Option B is the correct option, phenytoin. Question number 5. A drug produces maximal efficacy despite occupying only a small fraction of receptors. This is best explained by. ऑप्शन है टेकीफाइलैक्सिस, ऑप्शन सेकेंड स्पेयर रिसेप्टर्स, ऑप्शन थर्ड टॉलरेंस, ऑप्शन फोर्थ डाउन रेगुलेशन. So the correct option is option B, spare receptors. Next question is question number 6. Which phase of clinical trial is primarily designed to detect rare adverse drug reactions? First is phase first, second is phase second, option C phase third, and option D phase 4. So the correct option is option D phase 4. Question number 7. The first in-human administration of a new drug usually occurs during. Options are preclinical studies, option B phase first clinical trial, option C phase second trial, or option D phase third trial. So the correct answer is option B phase first trial. Question number 8. Which of the following is classified as a type B adverse drug reaction? Options are hypoglycemia from insulin, gastric irritation from aspirin, anaphylaxis from penicillin, or bleeding from warfarin. So the correct option is option C, anaphylaxis from penicillin. Question number 9. Pharmacovigilance is primarily concerned with. Option number 1 drug synthesis, option number B drug pricing, option number C detection and prevention of adverse effect, Option number D, drug distribution. So the correct option is option number C, detection and prevention of adverse effect. Let's move to the question number 10. Question is the WHO International Database for Adverse Drug Reaction Monitoring is maintained at. Options are A, Geneva, B, London, C, Uppsala, or D, New York. So the correct option is option C, Uppsala. Question number 11. Which receptor is an example of a receptor tyrosine kinase? Options are beta receptor, option B, histamine H1 receptor, option C, insulin receptor, option D, nicotinic receptor. So the correct option is option number C, insulin receptor. Question number 12. Competitive antagonist characteristically. Options are reduce Emax only, option B, shift dose response curve to the left, option C, shift dose response curve to the right without reducing Emax, or D, produce irreversible blockade. So the correct option is option C, shift dose response curve to the right without reducing Emax. Question number 13. Which statement regarding enzyme induction is correct? Options are it usually occurs immediately after a single dose. Option B, it decreases synthesis of metabolizing enzyme. Option C, it may reduce the efficacy of oral contraceptives. Option number D, it always increases drug toxicity. So the correct option is option number C, it may reduce the efficacy of oral contraceptives. Question number 14. A drug that binds to a receptor and produces less than maximal response even when all receptors are occupied is called. Options are option A, full agonist, option B, partial agonist, option C, competitive antagonist, option D, inverse agonist. So the correct option is option B, partial agonist. Next question. Which phase of clinical trial is most likely to involve several thousand patients across multiple centers? Option A, phase first, option B, phase second, option C, phase third, or option D, phase fourth. So the correct option is option C, phase third. Question number 16. The therapeutic index of a drug is calculated as. Options are ED50 upon LD50, option B, LD50 upon ED50, option C, ED95 upon LD5, option D, clearance upon volume of distribution. So the correct option is option B, LD50 upon ED50. Let's move to the question number 17. Which of the following is not a characteristic of an ideal pharmacovigilance system? Options are option A, spontaneous reporting, option B, signal detection, option C, risk assessment, option D, elimination of all adverse reaction before marketing. So the correct option is option D, elimination of all adverse reactions before marketing. Before marketing. Option B. Next question, question number 18. A patient develops severe hypotension after receiving a drug that blocks alpha 1 receptor. Which psychological effect is most directly responsible? Sorry, which physiological effect is most directly responsible? Options are: option A, increased cardiac contractility; option B, peripheral vasodilation; option C, bronchoconstriction; option D, increased renin secretion. So the correct option is option B, peripheral vasodilation. Peripheral vasodilation. Next question, question number 19. Which of the following is a major inhibitor of CYP450 enzymes? Options are: phenobarbital; option B, carbamazepine; option C, rifampicin; option D, erythromycin. So the correct option is option D, erythromycin. Next question, question number 20. In pharmacology, signal is in pharmacovigilance refers to. The question is, in pharmacology, signal in pharmacovigilance refers to. Options are: confirmed proof of causality; option B, a suspected relationship between a drug and an adverse event requiring further evaluation; option C, the frequency of drug prescription; or option D, the therapeutic dose of a drug. So the correct option is option B, a suspected relationship between a drug and an adverse event requiring further evaluation. So that was the last question.